ICP, intracranial pressure, measures the pressure of brain tissue in the cerebrospinal fluid that cushions and surrounds the brain and spinal cord. It is used to monitor the health of the brain after an injury. An increase in ICP can be caused by a brain tumor, bleeding into the fluid around the brain, or swelling within the brain. Increasing intracranial pressure can be life-threatening. It is essential to seek medical treatment, as untreated intracranial pressure could result in damage or brain damage to the cerebral cortex or spinal cord. Signs of intracranial pressure increase in intensity through childhood. During that time, babies may vomit or show tiredness. They might exhibit an external bulging in the fontanelle, the soft spot atop the head. ICP indicators in youthful babies may indicate mistreatment, specifically shaken baby syndrome. It can also result from separating bones in the skull's cartilage layers. Older children and adults may experience symptoms such as tenderness, headache, lethargy, seizures, vomiting without nausea, decrease in consciousness. Neurological abnormalities, abnormal eye movement, double vision, and numbness. Elevated intracranial pressure can occur independently or alongside other disorders. The most common causes include brain tumors, trauma, intracerebral hemorrhage, ischemic stroke, meningitis, hydrocephalus. Increased intracranial pressure, obstructed airway, hypoventilation, hypertension, seizures, drug-related interactions, posture, edema, encephalitis. An assessment of elevated intracranial pressure is typically made during an emergency room visit or while a patient is in a hospital. Early symptoms of increased ICP may be discovered by a physician during a routine physical examination. Another sign that a measure of elevated ICP is papilledema, or swelling of the optic disc, may be found during an eye exam. To confirm the diagnosis of elevated intracranial pressure, a CT scan or MRI of the head may be performed. It may also be measured by conducting a lumbar puncture of the spine, also known as a spinal tap, to measure the pressure of a cerebrospinal fluid. An increase in intracranial pressure is seen as a severe and life-threatening medical emergency. Treatment is aimed at reducing stress. Patients will be treated in the intensive care unit, ICU, of the hospital. Treatment of increased intracranial pressure includes the following: IOP, drainage of cerebrospinal fluid, support for breathing. Medically induced coma, hypothermia, decompressive craniectomy. Hypotension is a common complication of invasive procedures owing to critically ill patients. Failure to conduct treatment or reduce intracranial pressure can result in temporary or permanent brain damage, coma, or death. While some circumstances that bring about ICP can't be prevented, many leading causes, such as head injury, may be prevented or managed. Making particular a helmet is used when playing contact sports or riding a bike. Vehicle accommodations, and including a child safety seat, are a few ways you can help prevent significant head injuries. Matthew, a survivor of cancer and stroke, requests that you help spread awareness of severe diseases by publishing this video. Please take a moment to subscribe to and like this video.